Hi, welcome back to Ask the Doctor. I'm Dr. Kanter, and this is the Oak Cliff office. And today we're going to be talking about disc herniation. Now I know Dr. Bozeman already covered that a couple episodes ago. We're going to kind of work a little more into it and talk about things like that you should avoid and things you can do with your doctor's supervision to help alleviate pain. Okay, so disc herniation. We have your spine, or at least a part of it. And normally, with normal motion, you can bend forward and extend and have no pain at all. Unfortunately, sometimes you can have complications where if you bend with weight, you can have a disc herniation where the disc material pushes through, as you can see there. If it comes back far enough, it can hit a nerve. And if it does that, well then you might have pain that comes down the leg or arm depending on where that disc herniation is. Now you might be thinking, oh my gosh, this is me forever. Don't worry, not necessarily. We can do a lot of things here at Texas Healthcare to help with pain associated with disc herniation. A couple of those things we're going to talk about here in just a minute. But what kinds of things can cause a disc herniation? Well, let's say you're driving your car. And all of a sudden, you get hit, bang, and you're thrown forward. That is not comfortable at all. So, now, go ahead and stand up, and your back hurts. It hurts mostly when you're sitting, when you're bending forward, or first thing in the morning. That's no good. Go ahead and have a seat, please. Okay, some movements that can make a disc herniation seem more painful include bending, twisting, sitting, driving a car, things like that. If the disc affects the nerve, you might have pain, numbness, or tingling coming down the leg, into the foot sometimes. Usually it runs past the knee. It might be deep in here, somewhere you can't quite get to it, but you feel like you want to just hit your leg and just alleviate that pain. Well, those are signs and symptoms. But here at Texas Healthcare, we can do some things to help alleviate that pain, like adjustments or exercises. Let's go face down. So typically, when you have a disc herniation, it got that way because of bending forward. So what do we do to help fix it? Well, we work the other direction, but we have to do it carefully and correctly. So we'll start out working through a progression of movements to see which one's the right fit for you at that time. Usually it looks like this. So we're going to put our hands above our head right up here. Great. Then we're going to just bring our head up, and we're going to go back down. And we'll do that maybe 10 times and see how you're doing. Great. And then we'll work our way up through the progression. So we'll push our upper body up off the table, noticing her arms are straight. We want to see those arms straight. And we go back down. We'll do that maybe 10 times and see how we're doing. Whether you're better, the same, or worse. Hopefully you're not worse. As we go through this, great job, we're going to want to see that pain or numbness in the leg or in the foot coming up out of the leg. Maybe it's only now in the thigh, maybe it's only now in the butt, maybe it's just here in the low back. Sometimes, as that centralizes, that's what we call it, centralization, as that centralizes, it might be a little more painful in the low back. But don't worry, as we continue with treatment, that's going to get better. You are in good hands at Texas Healthcare. This is where you need to be. We're going to take great care of you. Thank you so much for listening, and thank you so much for watching. I don't see any questions right now, but if there are any, let us know. Look forward to seeing you next week.